Hello, everyone, and welcome to the Creating and Strengthening Park Prescription Programs, a three-part webinar series. My name is Ann O'Neill, and I will be moderating this webinar for you today. Our webinar is part 3 of the three-part webinar series entitled Part 3, Implementation and Evaluation. Some of you may have attended the previous webinars on partnerships on September 28th and on needs assessments on October 19th. Today, we're going to be talking about the implementation and evaluation of park prescription programs, which is so important to capture evidence-based success and learning and share it collectively for the growth of the National Park Prescription Movement. First of all, I would like to acknowledge again that this three-part webinar series is hosted by the National Park Prescriptions Initiative, which is made up of the National Recreation and Parks Association, the Institute at the Golden Gate, and the National Park Service. The Institute at the Golden Gate organized this webinar with support from a grant from Kaiser Permanente Community Benefit Northern California region. A big thank you also to Leah Casa, who is the Health Fellow at the Institute, for organizing the series. A few logistical items for today. What you see on your screen, in order to hear the audio, please call the number that you see in the first bullet. All of your phone lines are muted. In order to download a PDF version of these slides, you will notice on the right hand of your screen a handout panel, and there's a PDF available there that you may save on your computer. In terms of questions, if you have any problems during this webinar, please visit the website. You can see the link there under questions in that first bullet. We also have a Q&A portion for this webinar after the presentation. Feel free to enter your questions in the chat in the box, which we will address later. So to go through our agenda for today, we will be going through introductions, then panelist presentations, followed by Q&A and closing remarks. And to introduce our speakers, as I said before, my name is Ann O'Neill, and I am an outdoor recreation planner with the National Park Service, National Capital Region's Rivers, Trails, Conservation Assistance Program, and also very much connected with the National Park Prescriptions Initiative. I am very pleased to introduce our three talented speakers, Kevin Wright, who is the Government and External Affairs Coordinator with Marin County Parks, followed by Dr. Sarah Messiah, who is the Research Associate Professor at the University of Miami School of Medicine, and then Jason Urroz, who is the Director of Kids in Parks with the Blue Ridge Parkway Foundation. To give you a little bit of background, if you missed our previous webinars, the National Park Prescriptions Initiative began in 2012 when a group of partners got together after they noticed that a lot of local park and recreation agencies, state parks, and national parks were linking up with health providers to improve individual and community health. This group got together, and later we convened experts from across the country, and we've continued to convene this group, which has really grown and evolved into the National Park Prescriptions Initiative. Like I said, for those of you who are unable to attend our previous webinars, park prescriptions are programs designed in collaboration with public land agencies, healthcare providers, and community partners to encourage people to utilize parks, trails, and open space for the purpose of improving individual and community health. What's wonderful about park prescriptions is that it really connects people to places that help them get healthy in their backyard while building new stewards of our local, regional, state, and national public lands. As some of you may know, park prescriptions is something that is low cost and affordable. There are many issues affecting people today with health equity, health disparities, obesity, and park prescriptions is a wonderful way to get patients healthy in their backyard. And you'll see today that programs vary across the country. We know there are over 30 programs, but what the programs share are the benefits are vast, helping people improve their physical, mental, and emotional well-being, while also having social benefits as well. Today we're going to be hearing from 3 experts across the country about how they have implemented and evaluated their programs. Just a little bit of information of who is on the call today. You all provided some background about yourselves, and what you see on the screen here, about half of you have a park background, and about 20% are in the public health and medical sector. You'll note that a majority of you are interested in learning about and or starting a park prescription program, and 30% of you are currently creating or have an existing park prescription program. Also, the most common challenges you have are partnering and identifying funding. Now we're going to move into our first presentation, which meets our first learning objective, which is that participants will learn about park prescription program implementation, scaling up, and sustainability over time. With that, I'd like to turn the presentation over to Kevin.
Thanks, Anne, and good morning or afternoon, everyone. Again, I'm Kevin Wright, Government and External Affairs Coordinator for Marin County Parks. Today I'll spend most of the time talking about our Marin City program, but we'll end briefly touching on our newest program serving San Rafael and Novato. Great, I'm just going to touch on some background on Marin City. So Marin City is in southern Marin, adjacent and north of Sausalito. Is the lowest income area in Marin County and has the largest concentration of public housing. The family poverty rate is 24% compared to 3.5% in greater Marin County. There's a 60% adult and 38.9% childhood obesity rate. And also the life expectancy of a Marin City adult is 78.6 years compared to the nearby community of Ross at 94.4 years. Ross is a more affluent community. So moving on, I'm just going to cover briefly how the program works, and you can follow the steps in the middle of the slide there. So the patient pays a visit to the healthcare provider, and the provider notes health conditions including obesity, hypertension, diabetes, and or depression, and some patient interest in trying a new approach to their health. The provider flags their chart for follow-up by a health educator, and the health educator does most of the heavy lifting and begins by scheduling a meeting to introduce the park prescriptions concept and invites the patient to their first outing in addition to screenings and other work. The health educator follows up with a patient by phone before the first outing, typically meets them for their first outing and follows up by phone after the outing to ask how their experience was and invite them to future outings. The health educator also follows up in several months to monitor changes in patient health. And the health of the patients are tracked in the electronic medical records and also by an independent team of Health and Human Service epidemiologists. The goal of the whole strategy is to minimize provider burden by utilizing capacity of the health educator. And just a quick note about the park outings themselves. The park prescriptions outings are convenient to get to, inviting and reliable, accommodate the ability level of each patient, provide opportunities for regular attendance, and are hosted by the health educator, contractors, or a park prescriptions partner locally. And we actually developed these programs with a community-wide survey that gave us a lot of input about what folks are interested in the community. So now moving on to the actual site selection process, why we chose Marin City to focus our first program. Marin County Parks had been a longtime participant in Healthy Parks, Healthy People programming on our own lands and learned about park prescriptions through that collaborative. And our department had been working closely with County Health and Human Services, and we collaborated on a variety of outdoor physical activity campaigns and projects and healthy eating initiatives prior to working on park prescriptions together. So you can basically say that a strong point of the early development was this existing working relationship between parks and health. And together, our department saw huge potential in park prescriptions and began looking for a location or community in 2014. Marin County Parks and Health and Human Services were working with community partners in Marin City on the opening of Marin City's only public park and other park public health initiatives. And we agreed Marin City was a perfect fit for park prescriptions because it had a park, first of all, designed for physical activity, thanks in part to Trust for Public Land. And there are willing partners on both the parks and healthcare sides, and also several high health needs to address in the community. And after about a year of meetings, we were able to roll out the program. So regarding the implementation process, all the partners that essentially helped roll out the program were at the table from the beginning. And there was high-level, meaning director-level support and leadership at each organization that was at the table, which is really helpful. We consistently met in Marin City near the new park, and it was sort of fun to see as it was developed and then finally opened. So you could kind of, as partners watch the park come together during the construction process. Health and Human Service supported the meetings similarly to how a backbone organization would, with scheduling, note-taking, and partner coordination, which is a real key point. There was early support provided by Donna Long from the Institute at the Golden Gate, especially in the first meeting where she presented sort of key approaches from across the country that she was aware of. Meetings were used to agree on which patient populations to focus on, identify and coordinate resource contributions by the various partners, identify missing resources, problem solve throughout the process, and coordinate marketing, and generally just keep all of us working together and on track. I would say the most significant piece that fell into place that was identified as an early need was the health educator component. And fortunately, about midway through the process, the Marin City Health and Wellness Center was able to find the funding capacity to hire a health educator to support the implementation. And the added capacity and knowledge of the clinic setting provided by a health educator carried us from planning to implementation, and really from this being an idea that we're all discussing to a reality in the last 6 months of the planning. The health educator developed patient education materials, marketing, and prescription pads, and worked with providers on knowledge of the park prescriptions program and process. This person also refined the internal clinic process for handling patients throughout the park prescriptions process identified in slide 2, and acted as a liaison between clinic staff and the other park prescriptions partners. Meanwhile, other partners worked on the parks pieces. So Marin County Parks provided grant funding for free programming in the park and agreed to help maintain and enforce rules at the new community park. The park itself, called George Rocky Graham, officially opened, and other partners brought additional physical activity programming. And finally, toward the very end, activity instructors were onboarded to lead the activities that the community was interested in. So regarding sustaining the effort, this was a pretty simple key component, and that's just having ongoing meetings. And they're important for a number of reasons. First of all, there will most likely be staff changes, and so regular meetings really help with continuity. In our case, our health educator was promoted, who is a key component, and so there was sort of an onboarding and transition process that needed to happen through these key meetings. Regular meetings allow us to address unforeseen problems and maintain group communications and trust. Health and Human Services as a backbone organization is key to ensuring our meetings continue because they have the capacity and are able to make long-term commitments to support the project. And amazingly, all this was able to be accomplished without formal agreements, I think in part because of these ongoing meetings and communications. It also helped that there was early success to talk about, especially at the leadership level, that maintained a strong commitment from the top down. I would say if there was one remaining issue, it's that while we are serving patients well through this program and through the Marin City Health and Wellness Center, we struggle to engage the broader population of Marin City that use other healthcare providers. So finally, just ending on talking a little bit about our other program. After one successful year implementing park prescriptions in Marin City, we began working on a second program serving San Rafael and Novato with Marin Community Clinics and Health and Human Services. And interestingly, we learned that we just can't take one successful program in Marin City and plop it down anywhere, that there are significant differences in both the healthcare systems and geography. And looking forward, a few of these differences have included the fact that we'll focus on young people and their families in this new clinic setting, that we will have a different park partner and different park and clinic geography. So the park setting within, say, San Rafael is different, not necessarily within walking distance, for instance, versus Marin City where it's right down the street. We're helping to fund a health educator as our park agency instead of park programming, as is the case in Marin City. And we're providing education and outreach outside of the four walls of the clinic setting during weekly health hubs, which a health hub, you can sort of think of a food bank and also a community resource fair combined. I would say the common link between the two programs is that all partners are committed to the vision and they're meeting regularly to problem solve and work toward a shared vision. And there are some shared partners with prior park prescriptions experience in Marin City, including our department, Marin County Parks and Health and Human Services. There is also a balanced commitment between parks and healthcare. We also leveraged our experience in Marin City by bringing in Remy Mercer-Slomoff, who was the first Marin City health educator and is now the clinic manager to help open up the discussion with the clinic, talking about strategy and lessons learned in the Marin City clinic setting. And we also are expecting the development of this new program to take about a year. And that's it for me.
Kevin, thanks so much. Wonderful lessons learned to share with everyone here today. We're going to move to our next presentation, which will cover our second learning objective, which is that participants will learn how to collect and evaluate data to assess park prescription program success and impact. And I'd like to hand it off to Sarah.
Thank you, Anne, and thank you all out there in the audience for taking time out of your day to spend with us here to learn about Park Prescription Program. In the introductions, you obviously heard that I'm a professor here at the University of Miami, but I am representing a very dynamic team that includes not only my colleagues here at the university, but last and certainly not least, is all of my colleagues in the Miami-Dade County Park System, who I work with very intimately on our local park prescription program. Please advance. So very quickly, this first slide walks you through the evidence-based results to support our local park prescription program. It's called Fit to Play, and our evaluation measures were wrapped around a program that was specifically interested in preventing childhood overweight or unhealthy weight, and perhaps even treating it in our participants who already were challenged with a healthy weight while entering our program. So we collected a set of measures that we felt would not only show outcomes for the program, but were feasible for a park-based setting. These included things like body mass index, which is made up of a height and a weight, blood pressure, and physical health and fitness tests. Children with disabilities are also tested in the program. We're now in our 7th year of data collection and have published in the scientific literature multiple papers on the benefits of participation in Fit to Play, which then turned to about 18 months ago, us formally starting a park prescription program with my colleagues here at the University of Miami. So this just gives you a snapshot of the entire local park prescription program. It was really important at the beginning and development stage that we learned from the pediatrician and physician team what would make it work for them and what measures and evaluation did they want us to include in the field, and was it what we were in fact including in Fit to Play. And the big take home from them was that it had to be seamless and quick in clinic in terms of the referral process, meaning that if they had a patient that they felt would qualify for the program because of an unhealthy weight or an unhealthy blood pressure or perhaps sedentary behavior, that they could very quickly go to a computer and send out a registration form that would be then in turn received at the Park Health and Wellness office, and then that staff would take it from there in terms of registering the patient and the family, and then collecting all the follow-up measures that the physicians were interested in tracking in their patients. So, while our local program focused on childhood overweight, obesity, or unhealthy weight as the problem that we really wanted to tackle, and that largely came from a coalition of community leaders made up of schools, the health department, government, etc. It might not be the case in your local community, or it might not capture the resources and the strengths that your park system has. So you might want to ask questions as you're developing a program, thinking about design, and then in the long-term evaluation and evaluation measures you want to include is, who is it that you want to reach? Maybe it's an older adult population. Maybe it's families. Who can you partner with? This is key, obviously. As we heard from Kevin, it could be a health and human services group. It could be a school of nursing. It could be a school of public health. It could be a school of medicine. But the key is to find a champion for you, for parks, that's within a medical or healthcare system. What do you want to measure? Also, obviously, very key in terms of the evaluation component. You don't have to reinvent the wheel in a lot of cases. There are already a lot of great measures out there, particularly when it comes to mental health. There's a lot of surveys that are evidence-based, standardized, that you can use in the field, that are accessible in, you can even Google. They're in the scientific literature, and you can use them. Certainly, you always want to think about what's feasible in your setting and what staff you have that can actually conduct these evaluation measures. And ultimately, what would you like your ideal outcomes to be? In our case, it was developing children at a healthy weight and a healthy blood pressure. But you might want to think about things like just short-term goals for maybe patients that are coming out of surgery or cancer care, and how being in a park system can improve their mental health. Certainly, number one is to think about what's a realistic outcome evaluation measure. This diagram on the left shows you all of the clinical health issues that we deal with on a daily basis here at the medical school with our patients that are associated with their obesity. But the majority of the measures that we use in clinic to diagnose a lot of these comorbidities, we can't use in a park-based setting. So we need to think about what we can use and what park staff can be trained to do that can then in turn inform the physician partners. We found over the years there's 5 conditions of collective success when you are developing a park prescription program. That partnership that you develop with whomever it is in the healthcare system, you're both going to have to meet on common ground in terms of an agenda, meaning a patient population, and what you both want to see in terms of those outcomes and your evaluation measures, which would come from a shared measurement system, mutually reinforcing activities. Continuous communication, as Kevin mentioned, is absolutely critical and key. I think every day I talk to parks at least once or twice. And then finally, a backbone support organization that is going to support you as a park system. So our local park prescription program has collaborated in terms of the university and the park system in all phases of our park prescription program. This started way back 8 years ago with a common agenda, which I told you about already, which was childhood obesity, and goes all the way through to going to where we are now, to scaling up to a park prescription program. So you really want to team up at the very beginning stages of the program, and you do actually bond as a team through strengths, weaknesses, challenges, and so on moving forward. And that's really important. So the shared measurement system, again, when we all decided on the measures that we thought were the best to include for our evaluation, we had a team from the university of physical therapists, of dietitians, epidemiologists, and physicians train the park staff. So we call it a train the trainers model. There are lots of places out there in the community that can train your park staff on all sorts of biometric outcomes, schools of nursing, schools of public health, schools of physical therapy, etc. It's easy to take a height and a weight on a patient, child, or an adult. A waist and a hip circumference are also, all they require is a tape measure, but they're really nice surrogate measures of abnormal blood pressure and elevated insulin. We also take skin fold measures in 4 areas: bicep, tricep, subscapular, and suprailiac. That gives us more information beyond just the body mass index and tells us about how the actual body composition is changing in our participants, in that are we actually decreasing fat mass and increasing lean mass. This is important for our program because physical activity is a big component of it. It might not be in your case, but just I put that in there just to show you that, in fact, we have been able to train very effectively park staff to take these measures on our participants. Blood pressure and pulse, we also take and train park staff to do. A presidential fitness test, which includes a strength component, a cardiorespiratory component, and a flexibility component. And finally, a knowledge test that examines what our participants have learned in terms of their own health and wellness over the school year. So the next step is to think about, once you've decided on the measures that you want to include and you've got your park staff trained, now what are you going to do with that data? The model that we use, we collect it in the field. You can collect it on paper with a data monitoring sheet. You can collect it on a tablet. It can be automatically uploaded into a server. What we do here is both of those, and then the data comes over and is housed here at the University of Miami. So again, if you partner with a university or another system, you might not necessarily have to take responsibility for all of that data, especially if you don't have people on staff that have that expertise. So we house the data here at UM on our servers. It's backed up nightly, and we clean it and analyze it, and then finally jointly publish all our findings with our team. So just wrapping around, coming full circle, just think about, again, as you're developing your local programs, these 5 conditions, and I think that could definitely lead to successful programs. Thank you.
Thank you, Sarah. This is wonderful information. We will move to our final speaker, who will cover our 3rd learning objective, that participants will learn about park prescription program outreach and marketing in order to reach broad audiences. I'd like to pass it to our final speaker, Jason.
Thank you, Ann, and thank you everybody for attending today. My name is Jason Urroz, and I'm the director of the Blue Ridge Parkway Foundation's Kids in Parks program. Our program started up about 7 years ago in an attempt to get kids and families unplugged and outdoors and active for both their health and the health of our parks and public lands. In order to do that, we have created a self-guided brochure-led program where kids can go to a trailhead and grab a brochure from a trailhead sign and hit the trail and learn about topics, make discoveries along the trail that encourage them to be active outdoors and have fun in parks. And over the last 7 years, we've created a network of 150 different track trail locations in 9 different states and in Washington, D.C. And you can sort of see what our network of trails look like here in North Carolina, and encouraging kids to go to national parks and state parks and city county parks and a Forest Service site and Army Corps and all the different various types of public lands that we have here, but also across the country. Additionally, kids can register their hikes through our website, kidsinparks.com, and in doing so, earn prizes that encourage them to continue to participate in the program so that they can go to various sites and earn a sticker to put into their nature journal and move along through the program and visit various locations. Through those registrations over the last 7 years, we have learned a lot of things about the health of kids and families and the health of parks. We know through the registrations and the online or on-site observational studies that we've conducted in partnership with the universities that we've had about 260,000 kids register their hikes on our 260,000 kids complete track trail adventures. We've had about 8,000 kids register their hikes through the website. We know we have about 240,000 miles that have been walked and about 36 million calories that have been burned, and that's just the kids. We know that the families are coming in groups of 3, and so those numbers can be extrapolated to gain the overall health-based outcomes. Additionally, we know for the health of the parks that 49% of the kids were first-time visitors to the park, 53% were intentionally visiting the park to go to the track trail, and then we have about a 44% return rate. So kids that are coming are getting that prize through the mail, they're excited, they want to go to another place, and they're coming back and registering again and again. In order to market our program more effectively, we had to sort of create some custom ways of doing that with trails in 9 different states and spread out all across North Carolina and various other locations. We can't really advertise the program through traditional media and traditional outlets. It would be not really cost effective to have a newspaper ad in every newspaper in all the communities across the country. And so we decided to look at the park prescriptions program model in order to have doctors and prescribing the program and for our materials to be in the doctor's offices where these kids and families in those communities are visiting so that they can find out where our track trail locations are near their house. And so we have worked with the North Carolina Pediatric Society, which is the North Carolina arm of the American Academy of Pediatrics, to find doctors in North Carolina who were interested in having these materials in their doctor's office. We also have on our board of advisors several doctors, pediatricians from across the country who are on our board, who are helping us to place our materials in doctors' offices and hospital systems, as well as working with our park partners who have relationships with local healthcare systems, doctors, et cetera, to say, hey, we would like to place these items into your doctor's office so that the kids and families can find out about the track trail that we have at our location near your place. And so these are what our TrackRx materials look like. We have a pediatrician display, which kind of copies our trailhead sign, so the kids see this display in their doctor's office. And whenever they go to an actual track trail, the sign looks just like this, and they'll be like, oh, we made it to the park. So the materials are branded to look alike. The display can either be table mounted or wall mounted, depending on what that doctor's office wants. And the display houses a TrackRx brochure. And the TrackRx brochure sort of aligns with the 3 different health-based outcomes that spending time in nature improves. So your cognitive health, your physical health, and your emotional health. And what we've done is taken different activities from the brochures the kids would find if they go to an actual track trail, whether it's our flower brochure or animal athlete brochure or the Need for Trees brochure. And we've broken different activities from those brochures out into the TrackRx brochure so that when the kids grab this brochure from their doctor's office, they could do this in their backyard, their schoolyard, at their church, at any green space, or they could do this brochure on an actual track trail. But what this brochure does is it introduces them to the self-guided brochures that we have at our partnering trail locations. Additionally, we have a patient room poster, and we have a rack card that can be placed in the patient rooms, depending on if the doctor has wall space or not, or if they just want to put a little rack card stand in that room, either way. And what the patient room poster and rack cards do is they have a map that shows the network of the track trail locations that are in the region of that doctor's office. So as those patients and families are waiting for their doctor to come in to the office to see them, they can see the sign in the lobby, grab the brochure in the lobby, get into the thing, they see the dog and the dragonfly, they see the different branded materials, they grab this, and now they can start to see how this network might work for them. Finally, once the doctor gets into the doctor's office, the doctor can go over those materials with them if they have enough time, and then write them an actual prescription for outdoor activity and or to go on a hike on an actual track trail in their region. The thing that's unique about our prescription pad for Kids in Parks is that we have a 9-digit serial number that is customized for each individual doctor office, each individual doctor, and each patient. And so the serial numbers are sequential for that particular doctor. And when the kids go online to register or to fill their prescription through our website, they're prompted to enter their serial number. That allows us to track which doctor office the patient came from, which doctor at that doctor office wrote the prescription, and then it allows our website through this serial number to automate an email that automatically goes to either the doctor or to the administrator at that office or to both of them so that they can receive an email to know that patient, X came and fulfilled their prescription through the Track Trails program. The thing that it also allows us to do is to track that patient over time. And so if this patient comes in through a prescription, they're assigned a serial number on the back end of our website. And if that patient then goes to a track trail at a city park, and then to a track trail at a state park, and then to a national park, we'll be able to track that prescription caused this patient to come to the program for the very first time, and that over time this patient has now done 5, 10, 20 different hikes at various other locations. And so we'll be able to hopefully prove the success and evaluate the success of the TrackRx and Park Prescriptions movement. And so the things that we're trying to do is use our data as we get more and more of it coming in through the database to determine which doctors are successful in having their patients register their the TrackRxs. With the prescription pad having the doctor office code and the doctor code, there might be 5 doctors at that doctor office writing prescriptions. Well, if we determine that 2 of them are very successful at getting their patients to fulfill their prescriptions and 3 of them aren't, we can then go back and interview those doctors and find out what they're saying to their patients that's causing their patients to register at a higher rate, to then go back to the other 3 doctors and say, well, hey, listen, Dr. Smith is talking to his patients and explaining the program like this. Maybe you should have your interview techniques with your patients in this way. And hopefully over time, through a lot of data, be able to determine the things that those doctors are doing in that doctor's office or in that patient room with their patients to encourage their kids to be more active outdoors. The other thing that we want to do is to, like I mentioned before, track to see if those kids are coming in through a prescription, and then that's causing them to go to other track trail locations in the future, and at what frequency and how many times, and was that prescription the impetus for them to do the 5, 10, 20 different hikes in the future. And of course, once we have enough data, disseminate the data through the various peer-reviewed journals and get it out there so that more doctors know about Park Prescriptions and TrackRx and their ability to utilize these materials and this approach, this intervention technique with their patients to get them active outside. And so that's what I have. Here's the contact information for Kids in Parks if you have any questions.
Thank you, Jason. This was really wonderful. A lot of good information to think about. And I want to thank also Kevin and Sarah as well. As we have said, every park prescription is really different, and it's really about partnerships, as you heard from the 3 presenters, really having that shared vision of having it be something that entities are working on together with that implementation, evaluation, promotion, and committed communication. Right now, we're going to be going into our Q&A period, and I know some of you have submitted some questions in the question box, and I thank you for that. If you have questions, please enter your questions in the question box at this time. We're going to start with our first question, which is for Kevin. Anna would love to know more about Marin County's community-wide survey, as she would like to determine their local level of interest. Did you publish your results anywhere, and what kinds of questions did you ask?
Thanks, Anna. That is, I assume that's the survey to determine what types of physical activity outings to offer. That was actually led in partnership with Trust for Public Land right at the end of the construction period for the new park. And the reason Trust for Public Land was a partner was they were really interested in not just wrapping up the construction, but really beginning the engagement of the community around their new park. And so the timing worked out really well to partner with them. And we developed some really simple questions that were largely disseminated through the clinic setting, but also with a few community leaders that we worked with in the community. And I can't recall, I don't have them in front of me, but they were really simple around, what types of physical activities do you enjoy or do you do on a daily basis? What would inspire you to get out and try a new park or a new activity outdoors? And then we sort of shaped at least our programming where we hired instructors. So it resulted in, we hired a Kokoro instructor, which is sort of a someone who has like a program that includes meditation, personal empowerment. There's some like martial arts aspects. There is also a local Tai Chi person that we ended up hiring that catered events toward seniors and others locally. And we added that onto our partner-led events, which are things like short hikes around town and up into the open space, because Marin City is surrounded by the Golden Gate National Recreation Area. And so it was sort of a component of a suite of activities that people could choose from and participate in.
Thank you, Kevin. Here's another question for Sarah, and actually I'd like each of our presenters to answer this question on your own. The question is from Rupert. He's wondering how Sarah and the Miami parks handle the HIPAA regulation. He's having a difficult time envisioning the logistics for how park staff are doing the biometric measures while at the same time running programs and keeping the program fun for participants.
Okay, so that's sort of a multi-part question. So I'll say that it's not the same team that does the measures that implements the programming. It's a very specific, small core, what we call our health and wellness team, that is trained to do the measures. There's 6 of them. We have literally hundreds of coaches, and he's absolutely right. Not to mention all of the issues that you would run into in terms of reliability and validity of having so many people doing measures, and with staff turnover and so on, being able to stay on top of training. That's why we have a traveling team of 6 health and wellness staff that are responsible for all 34 sites and doing the measures. And it's very well, we've sort of gotten a system down where the park knows when they're coming. They do the measures as soon as the kids come into the park. It might take, depending on the size of the park, a day or 2, but the kids don't miss any of their normal after-school fit-to-play activities. As far as HIPAA goes, so I also see a question on my dashboard from Patricia about informed consent, and they go hand in hand. And we do handle, in this case, with fit-to-play and park prescription, the IRB of record is through the University of Miami. So we follow their guidance in terms of the informed consent. Every participant has to have a parent sign to consent that their child's their health information, their private health information, can be collected. However, none of the research team sees the actual names. It's all by a unique identifier number. Now, I mean, that's obviously one of the advantages of teaming up with a university that has an IRB and people who are well-versed in the language of their university, it's IRB. So that's one way to go about it. We have an entirely different program that's run at Miami-Dade County Parks that the IRB of record is actually called Sterling, and they're an independent group, and Parks is the lead on that. So there's 2 ways to go. Whereas if you have a big enough system with enough resources, Parks could actually find like a Sterling. There's also WIRB, W-I-R-B. There are 2 independent IRBs of record that you could contact and find out how the park system could be the oversight. And then those 2 organizations would take over the responsibility for the human subjects.
Thank you, Sarah. Kevin and Jason, do you want to really concisely speak to the HIPAA regulations as well with your programs?
Sure. This is Kevin Wright, and I'll just say that Parks leaves all of the, for instance, biometric data collection and things of that nature up to the clinic, specifically the health educator. And so really the only time we're collecting data about health is during the initial visit with the health educator, where they prescribe the park prescription for the first time. And then in a follow-up visit that may occur 6 months down the line, which is part of the reason why we have, at least in the Marin City program, somewhere between 60 and 80 patients participating, but only have follow-up data from 10 to 12 patients. And additionally, I mentioned the team of epidemiologists, and Health and Human Services really coordinates directly with the health educator regarding HIPAA, and they determine what they can share and how to share it.
And then this is Jason. I will add that Kids in Parks is not asking any health-based questions in regards to the kids. We don't ask their weight. We're not collecting BMI information or anything along that lines. We're mostly just collecting information about whether they did or did not do the activity. And so we're not also sharing any personal information with outside individuals or agencies. So the names of the patients, the address of the patients, the email address, all of that information is hidden, and all of the patients are tracked via serial numbers. Not the prescription pad serial numbers, but when they register through the website, they're attributed a trail tracker ID number, and that is how we track them. And when we evaluate the spreadsheets, we do that through that. So all that personal information is hidden, and that's how we get around the HIPAA regulations.
Thank you, Jason. Jason, I've got another question for you. At what point will TrackRx start evaluating their success tracking patients? It's noted that the program is 7 years old. For how much longer can you continue without having to see if you're successful? When will someone ask, when should new programs start evaluating?
Sure, so I saw that question on the dashboard. The Track Trails program is 7 years old, and I don't know if I was clear on this during the presentation. The TrackRx program with the serial number prescription pad and the ability to track the prescription through the back end of the website and enter a serial number so we can actually track the effectiveness of the doctor writing a prescription and then a kid's subsequent sort of involvement in the program and then going to Track Trails, in the future. That is new. That is 2 months old. We've only had our prescription pads in the hands of doctors for 2 months. And so the data set for that is very, very small, and the numbers would not be worth mentioning. The numbers that we had in regards to the 8,000 registrations and the 260,000 miles and the or potential kids who have walked the trails and the miles and the hours and the percentages of kids who are first-time users and returnees, that's the information or the data from the overall hiking part of our program, which we feel is very valuable towards showing the success of the trails on the ground part of the program. The TrackRx data will come over several years, I'm sure. It certainly won't come overnight. And as soon as we have enough data to report out, we definitely will.
Thank you. Thanks, Jason. Kevin, a question for you. What is the background of your health educators?
Well, that's a good question. They all have public health background, so like a master's in public health. And in both cases, they have been really new to the workforce. So typically they've come out of, they both have recently received their master's and come out of an internship of some sort with a Health and Human Service program in the Bay Area. And they were picked up by the clinic through a typical job hiring process. And, in all cases, they had some educational knowledge of the clinic setting that they worked on during their sort of onboarding. And then they typically were both, really good with people, just really social and outgoing and very positive and motivated. And so when it comes to program development and also working with patients outside the four walls of the clinic setting, they're really excellent to just sort of warm people up to a new experience and create an experience that feels supportive and positive and also safe.
Great. Thanks so much. Jason, who is interested in your data, and will it be in the public domain for our local development efforts?
Well, I'm certainly interested in the data, and I certainly hope that our doctors are interested in the data to know if their prescriptions are working to cause their patients to get outdoors and active. I'd imagine our park partners are interested in determining if patients are coming to their parks because a doctor had written a prescription for a kid to go to a track trail, and their park was the chosen location that that patient went to. And then I'm very hopeful that the American Academy of Pediatrics and the North Carolina Pediatric Society and any other pediatric sort of group that is looking at data and the success of park prescriptions programs nationally and the TrackRx program specifically would be interested in finding out how successful these programs are or aren't. Will the program or will the data be available in the public domain? Certainly, as we have it and we have enough to write a report about it, we'll try to get it into journals, and so through that it would be available. Or if you wanted to contact me, Eric, or anybody else to discuss, the program or how the data is being captured and how the data can be reported back to you as a partner, I'd be open to any conversations in regards to that.
And this is Kevin. I just want to mention one positive aspect of having a clinic or healthcare partner that if you have multiple small programs in a community or within a county, it's been really nice to have Health and Human Services provide an epidemiologist that follows between programs, because one thing that person is really providing is ensuring that the data we're collecting is sort of shared or similar across programs, so that we're not just sort of collecting positive outcomes in one case, but then they're not easily comparable to a different setting. That basically we're developing a larger picture looking at all these programs together.
Thank you. I just want to say thank you to all of our presenters, to all our participants who submitted wonderful questions. We're going to be wrapping up this session. If your question was not answered, please email it to Leah Casa at the Institute at the Golden Gate or to parkrx.org, which also will host many resources. We hope that you found the information today to be useful to you as you learn, create, or sustain a park prescription program where you work. I would like to acknowledge that this 3-part webinar series is hosted by the National Park Rx Initiative, which is made up of NRPA, the Institute at the Golden Gate, and the National Park Service. The Institute at the Golden Gate organized this webinar with support from a grant from Kaiser Permanente, Community Benefits, Northern California region. And a big thank you again to Leah Casa, who is the Health Fellow at the Institute, for organizing the series. Just a couple of reminders where you could access the webinar in the future. You will receive an email for a post-webinar series. And if you have any questions, please contact Leah. Thank you all for joining us today, and have a nice afternoon.